Hey everyone, I hope you've enjoyed my videos so far. And this one is getting into how do we reduce swelling, or what's sometimes referred to as edema, in the legs to improve walking ability, balance, and to decrease leg pain. Yes, in my practice, I see patients quite often who have pretty severe swelling in the legs, and this greatly affects quality of life. There's only so much room in our lower leg, in the compartments of the lower leg. And if serious swelling occurs, it places stress on nerves, blood vessels, and other structures, which can cause a lot of pain in the legs. Oftentimes the edema or swelling is hard to reduce, even with medications, and people are left with a really big restriction in their quality of life. Luckily, there's a physical therapy technique that works really well to address this issue, and that's what I'll be covering in today's video. I hope it's really helpful, and be sure to hit the subscribe button. Now, there are some conditions related to your heart in which you should not be placing your legs higher than your heart. So if you have any history of problems with your heart, any kind of heart disease at all, I would first contact your physician and check with them to see if this is an okay technique for you to use prior to using this. You might need some assistance from a caregiver to put some pillows or some blankets to make, as you can see on my left, some kind of a mountain of pillows or blankets. This is best done in a bed because you're going to have a little bit more room. Sometimes I work with patients who can't lay down in bed, so we have to do this from the recliner. So to do this, what you want to do is lay down. You can use a pillow if you'd like, and place the legs up on your mountain of pillows. Now, as you can see, I have a straight shot. There's not a kink in the knee. Again, if you were sitting like this, even if you were ankle pumping, the fluid's just going to come up towards the knee and then come back down. It's going to stay kind of pooled in the lower leg. So by getting the legs straight completely, and then again adding the ankle pumps, that can be the most effective way to get rid of the swelling and edema in your legs. So what I call it is the rule of 20s. So you want to elevate for 20 minutes. Now the fluid's got to go somewhere, so you might need to urinate after you've been in this position. So I'd recommend to urinate before you do this technique. And then staying elevated for 20 minutes is important, but also pumping for 20 pumps on, and then resting for about 20 seconds in between, what I call the rule of 20s, just to make it easier for patients that I'm working with to remember. So 20 minutes elevated, 20 pumps, and then about 20 seconds of a rest break in between each pump. Doesn't need to be exactly 20 seconds. It could be 10, 15, 25 seconds, but taking a rest break in between. So again, it's pretty basic. Just elevating the legs up, 20 minutes pumping, 20 seconds of a rest in between for about 20 minutes. The hardest part about this technique that I find in my practice is just getting into this position. So I by no means expect that someone with quite a bit of mobility impairments will be able to do this by themselves. That's why it's often nice to have a caregiver. Now, if you're sitting in a recliner and you can tilt that recliner back, you can put some pillows beneath your legs against the recliner lower body component. And as you tilt back, your legs will be a bit more elevated like this because you've put the pillows in there beforehand. That's a nice technique to do this by yourself. So if that works for you, just sit in your recliner, put some pillows behind your lower legs, then hit the recline button. So as you recline back, you get into a similar position as this. And then again, combining the ankle pumps. So from this angle, just laying down, legs up. You can use a pillow if you like, and then you're pumping your ankles. Straight shot, straight legs. I would do this 2 to 3 times a day. And like a lot of things in medicine, it's something that you're going to have to keep doing to keep getting the benefits. Similar to how you keep taking the same medication for a certain benefit, or you keep doing the same exercise to achieve a certain benefit. Same way. Because gravity will always be pulling that fluid down into your legs. So if we're staying in a seated position with gravity pulling that down, it will pull it back down. But if you're elevating again, you can keep reducing that. And through medication management and with this technique as well, you're going to receive the best way to manage your swelling or edema at home. So this video has been all about what can you do to reduce swelling or edema in the legs, to reduce the heaviness, improve someone's walking ability and balance, decrease fall risk, and to assist with pain management. But there are so many different topics I could post about. It all just depends on what you guys would like to see. So please post your comments below and subscribe so I can do my best to create a meaningful video for you or a loved one to improve quality of life. This is Dr. John Mayo, physical therapist, really hoping that this program is helpful for you or a loved one and improves your life.